Hi, good morning, everyone. Welcome to this week, 11th of December International Weekly Meeting. This is the 88th edition. We met about 88 sessions before, and all the CMAAO countries came together to fight for the pandemic. And today we are getting an update from all the countries of CMAAO, what's going on around with this new variant. We are hearing a lot of news that it's not that concerning. It is spreading more rapidly, but it is not concerning too much. It's a mild than what Delta is. So let's hear from everyone. I will let Dr. Jamal Chaudhary to start the meeting with the country update from Bangladesh.
Sorry, Saurabh, actually, my internet was interrupted. So I'll just tell a bit later.
Okay.
Thank you.
Okay. Dr. Chong, would you like to start since you're in an airport, and would you like to give an update from Singapore? You're on mute.
Okay, can you hear me now?
Yes.
Okay, I think the situation in Singapore is quite stable. I was able to travel out of Singapore on a vaccine travel lane, a special travel lane with the Australian government. So we were not subjected to quarantine. But my first 3 days here, because of Omicron, was subjected to a 3-day isolation in my son's apartment. So that was okay. We were here to see him anyway. Back in Singapore, I think we have about 700 cases today. And the majority, 98.7% of them, are all mild. And the number in hospital is, only 0.2%. And we have 2 cases of Omicron detected. I think one of them is in quarantine, and the other is also on a flight in. So it wasn't a community case. So far, we have not registered any other Omicron cases in the community. So I think that's all we have to say from Singapore. But we are opening up our doors to various countries, having vaccine travel lanes with several countries, and life must go on. Thank you.
So, Dr. Chong, I have 2 questions from you while you were talking. What about your travel? Like, since you've done a travel and you're already doing a travel, so what are the restrictions for the travel? And when you're traveling, what all you have to, like, you have to inform the authorities, you have to get a certificate, you have to take COVID test like within 6 hours to 10 hours. How does it work?
Okay, for this trip, when I came to Australia, I had to do a PCR with 72 hours before I left, show documentation to the airport counter before I can check in. I also have to have an entry permit into Australia federal government, by the Australia federal government, as well as one by the state government of Victoria, where Melbourne is. So I had to have 2 permits, which I could apply online. And then on arrival, the first 24 hours, first 72 hours, I must isolate in a place. It's not quarantine. It's not in a hotel facility. So I stayed in my son's apartment. But the first 24 hours, I'm allowed to go out to get a PCR swab. So I got into a car, my rented car, and drove to the PCR center where we did a drive-through swab. And then I came back to the apartment, stayed for another 3 days in total, and then I was free to move around. On day 5 to 7, I had to do another swab, PCR. And then, of course, I have to do another PCR swab 48 hours before I left. So I did it on just recently, 48 hours ago. And the Singapore government, this is required by the Singapore government. It's not PCR, it's an ART. So I did an ART. And just now at the airport, when I was checking in, they wanted to see my vaccine certificate, my Singapore arrival card, which I have to apply to the Singapore government. I have to book a PCR test online in order to get a PCR done in Changi Airport when I come home, as well as I must book transport from the airport to my home. So they require quite a number of things. So when I checked in, they wanted to see my vaccine certificate from Singapore. They wanted to see my recent ART. So this is what has happened. When I go back to Singapore, I will land at Changi Airport. I will have a PCR swab on arrival. I have to stay in my home for 6 hours or more until the PCR swab test is back. I cannot leave the house. And thereafter, for every day, for 7 days, because of Omicron, I have to do an ART myself. So I have 7 days of ART ahead of me. and on the third and the seventh day of my ART, it has to be a supervised ART. I have to go to a place to do an ART. I cannot do it myself. So that's the hoops I have to jump through. Thank you.
Okay, one of the cases which has been detected in Singapore. So this question is for Dr. Chong or for anyone who wants to speak, especially the South Africa, Dr. Angelica. 2 cases has been detected in South Africa where on Omicron, where they all had booster shots. So the news which I read in the morning was Omicron variant was detected in 2 people with the booster shots. So
Yes.
have you read about that news?
Yes, I saw that just now. 2 persons with booster shots. That's right. So I don't know what booster they receive, but in Singapore, we are given Pfizer and Moderna. Most of us have done Pfizer and Moderna, but there's a group, about a couple of 100,000 people who did the Chinese vaccines, the inactivated Chinese vaccines. So I don't know the 2 patients, what vaccines they received. I will find out for you and let you all know.
And
Okay.
if I can also come in,
Yes.
we use Pfizer and Johnson & Johnson. So again, the Pfizer efficacy lasts about 3 months with, and then you need to get your booster shots. The majority of the patients with breakthrough infections that we have seen, they last vaccine, fully vaccinated on Pfizer, anything between July up until even October, they still get breakthrough infections. So we have this, even if the patient says to you, I'm not feeling well today, and you ask, when was your last Pfizer? And they tell us it was July or August, you've got a 50% probability that they will test positive. But again, it's mild. We have seen it. You tell me which combination you can think of, and I can tell you we have seen it. Because we keep very, very strict records on the immunization. And again, the thing is mild disease. That's what the vaccines is always say, that everyone was saying that vaccines is not going to protect you that much against mild disease. It's always against severe disease. And that is the most important thing for me, because it seems that it is really protecting still against severe disease, even though it's got 13 plus mutations and escape the immune system and all of that. But it's what we see clinically on the ground. That's the important thing. Thanks.
Yeah, even the Pfizer and biotech has said that the initial lab study shows that the 3rd dose of vaccine may be needed for neutralizing the Omicron variant. And
Saurabh?
Yeah, Dr.
So I've just joined the meeting. I just heard about your information. The 2 cases of booster dose have suffered with this Omicron, and Dr. Chong has endorsed this. Just I want to know that either they are having the comorbid, or what is the age of that, and then you have said what booster, what dose, what vaccine they have taken. Do you have any data about that, detail of that?
So the information is not completely there, but it says that both people are recovering in the isolation at the National Center of Infection Disease, and all the close contacts have also been done as a 10-day quarantine in the system. And there were 2 residents of Singapore who were traveling, and one of them came from Germany, I think, on December 6th, and the other one is I think another one is a service worker who is returns from some other place, and who's a female, and they both are young. They're not very old. They're like 24, 25 years old. So I'm not
Yes,
assuming.
Saurabh.
Yeah.
Saurabh, I can tell you right now.
Okay.
The first is 24 years old. She's an airport worker, and the other is 46 years old, and she had come back from Germany. In addition, we have 3 new cases today reported today. One is 38 years old who works at the airport. One is 30 years old, came back from UK, and one is 26-year-old who came back from UK. So it looks like the patients, the Omicron cases we have in Singapore are fairly young.
They have their booster doses, Dr. Chong?
It's not known in our ministry press release, whether they are boosted or not. It's not very clear.
But they are vaccinated.
Presumably because they came back on the vaccine travel lane. The 3 cases who came in from abroad are Singaporeans who have been vaccinated and allowed to travel on the vaccine travel lane. The special lanes that are for vaccinated travelers who do not need quarantine.
So, Dr. Chong.
Yes, morning.
Good morning. This is Alvin. May I ask you, so from the news that, can you hear me?
Yes, go ahead, Dr. Alvin. Go ahead. Good morning.
From
Dr.
the news
Keshav
that there is a community spread case that's not contacted in other countries. Is that true? One case is a local. No.
So far, 3 imported. 3 came through vaccine travel lanes. 2 are working in the airport.
I see, working in the airport, but they most likely were infected by the imported case. Probably
by passengers. By passengers, yes.
Dr. Chong, can I have a personal question?
Yes.
You are looking so fresh, so smart. What is the reason behind? Can you guide us?
I'm at the Melbourne airport. I'm at the Melbourne airport coming home.
Okay.
Wonderful.
Good. Very good.
Dr. Sajid, your profile picture is also very, very good. You're
thank you very much,
smart
Alvin.
and telling the public some important news.
Oh, good.
As
Thank you. Yes, exactly the same.
Dr. Alvin.
Yes.
Yeah.
Yeah, Dr. Jamal.
The post you posted actually there in our group. Can you just give some sort of idea and just enlighten the things about the public hearing in USA?
Public hearing of what?
USFDA. Probably you have posted, right?
Dr. Jamal, we'll talk about this after the update.
Okay.
We can continue with the session. Dr. Alvin, would you like to update us on the Hong Kong situation on the COVID?
Oh, yes. In Hong Kong, we still enjoying the very tight quarantine and restriction rules. That is almost like a lockdown of Hong Kong because all foreigners could not come to Hong Kong. And all those coming back to Hong Kong, citizens of Hong Kong, were also quarantined if they are from any we call high-risk places, would be 21 days. For the medium risk or low risk, then less stringent, but still perhaps 14 days in a designated hotel, and then 7 more days at home. Most likely, if now we have not yet say that we don't allow citizens to come back from some places. We didn't have this. Our citizens from South Africa, from UK, or from America still come back, but still have to be quarantined for 21 days. Now, we have 5 imported cases so far as I know. The last one is from America, from USA. So I think there's already community spread in many countries already. According to WHO, there are already 57 countries or regions, including Hong Kong, that had got the Omicron cases. For Hong Kong, all the 5 cases were imported. There's no local cases. But I think we need to be very stringent to prevent any spread from the imported cases to the community. Right now, we couldn't afford to have any spread into the local community because the vulnerable old-aged citizens has a very low immunization rate. The COVID-19 vaccination rate for elderly over 70 years of age is still less than 40%. And for those over 80 years of age, it's only 20%. So once there is community spread, these elderly would be very vulnerable because we are now more open in the community. We can eat everywhere, anywhere. The elderly are also enjoying a lot of family gatherings or even social gatherings because, even 90 years old, very ambulatory and enjoying social life. Dr. Mahathir in Malaysia could be the prime minister at the age of 93. I always adore him, but unfortunately, he gave up his own power and his position. And so as a medical doctor, I think he, as a medical doctor, had been a very good example that medical doctors could be politicians as well. But in Hong Kong, our dean of our medical school in the University of Hong Kong, Dr. Gabriel Leung, who have been quite instrumental in in advancing our policies in Hong Kong for prevention of the COVID-19 and any communicable diseases or non-communicable diseases. As the dean of the School of the Community Medicine, he had just left University of Hong Kong. It's quite a shock to us because he is such an important epidemiologist and a specialist in the community medicine. So he is quite a key figure in the strategies in the prevention of COVID-19 in Hong Kong, but he then left the post abruptly. His contract should end next year, next summer. But then he ended it prematurely this year, going to Jockey Club as the in charge of the charitable session. So he's giving up the entire medical profession and his goodwill. So I was so surprised, and I think it's not good for Hong Kong because in Hong Kong we need to conquer or overcome this COVID-19 and win in the battle together with these experts and the solidarity of all the profession in Hong Kong. But then, anyway, this is our situation. We have no more additional mortality figure, still 212, and we are still only having 12,000 cases. And so the only thing is that we are going to have a cross-border communication probably next week between Hong Kong and mainland China. That is, people could cross the border, but at first stage, it's only a limited number. Later on, will be open to more citizens so that we could cross the border. Of course, the prerequisite is that we still will have good control with no community spread of local cases. We could upgrade our WhatsApp to almost not a mandatory, but then every citizen would have one. But we would have the WhatsApp. I guess the the Hong Kong citizens, some of them are still very reluctant to use these WhatsApp tracing. Excuse me, that's what I have to say. And thank you very much. I have to deal with a patient right now. So bon voyage, Dr. Chong. Bon voyage and safe home tomorrow or tonight. Okay.
So
thank you very much.
Thank you, Dr. Elvin. That was a nice update. Can I invite South Africa, Dr. Elvin Kodzi and Dr. Akhtar Hussain for a much needed update, what's happening in South Africa?
Ek gaan nou praat. Morning to everyone. Yes, I'll give Akhtar, I hope he's here, the update of the cases, but I do send you guys the update now on a daily basis. It seems to me that in Gauteng, which is the province of the epicenter, if you look at our daily numbers, they most, it's stabilized. And the clinical picture, this is our 4th week, still stays the same. Still very, very, I'd rather say very few admissions from general practitioner side. Although all the big doctor groupings confirmed that they don't really, haven't really sent anyone for admission. We're still the same. I'm a bit reluctant to say, but I think this might be at primary healthcare level with the more mild disease. It might be self-limiting. It's definitely not the same than Delta, and I think there's a huge hype out in the media, and everyone wants, because of the structure of the spike proteins, everyone wants it to be worse than Delta. But let me tell you, Delta is the worst. And Omicron, for me, the severity is not even close to Delta. And I don't have a problem if there's breakthrough infections. I've seen one with a Johnson & Johnson booster. I did alert Prof. Glenda Gray and said, listen, I've seen one person with COVID positive after her booster. So, but again, I don't, if it's mild like this, regardless whether the boosters protect you 100%, I can live with that. It is in severity if it's like Delta. And I don't think it will replace Delta in terms of severity. By now we should have seen it. And everyone is worried, but, it's not, that's why I said it's a storm in a teacup with the clinical picture. However, admissions, that's something different. But again, I think Dr. Chan said that there's still Delta going around, and Delta, we need to know that whether the patients admitted at ICU for COVID, whether it's Delta related to Omicron, and that stats we can't get out of the hospitals. So maybe if any other country can have that and tell us the severity of Omicron in ICU, that would help and assist us. But for the rest, it's mild. If people get this easily infected with Omicron, maybe that would help with antibody protection going forward with other variants coming in. And maybe that would help. I don't know. But for me, there's a whole hype, and I don't think the clinical picture warrants that. Thanks.
Hi, good morning, colleagues. In South Africa, last 24 hours, we had 19,000 cases. Yesterday, day before yesterday was 22,000. At the moment, that is the range, varying new cases. And the death was between 20 and 25 last few days. In South Africa, total, we have tested 20 million. And 3 million came out positive reported. Our recovery rate is 2.8 million. And total death so far is 90,000. and recovery rate now 92.5%. At the moment, 29.7% cases from 75,251 tested, and those are the Omicron virus. People admitted around South African hospital, 4,795. Out of that, 398 patients was in ICU, 148 patients were on ventilation. And the length of stay in the hospital average is 2.5 days. And the other issue is positive test for infect positivity or in the children between the age of 10 to 14 is climbing. And we didn't see before that high number in children. Our health worker is about 20% healthcare worker infected with Omicron variant, and that is now 72,000 public sector out of 400,000 healthcare workers who do the clinical and supporting stuff. Thank you, Saurabh. Thank you.
Can I just ask a question to Dr. Angelique and Dr. Akhtar? I have seen your figures. They are actually ICU and ventilator. In ventilator, they are much less in comparison to your admission. What is the policy of hospital admission there? Are you admitting the moderate cases also?
No, thank you for that question. We do not admit anyone from primary healthcare if you're not severe. You need to. So we treat them all at home. We see them physically, and we treat them at home. So then, if you look at the hospital admissions, the number that Dr. Hossain said, that 4,000 is not people with Omicron or with Delta. It's people who's been admitted to a hospital for any other reason and then incidentally are found to have COVID. So the stats are not 100% right, and we are asking, please give us the stats of people admitted solely on the grounds that they have COVID-19 with complications. So in our hospitals, if you are admitted for a routine operation or whatever reason, you must be screened. So that's a routine, they screen. And then unfortunately, they will then say there's COVID-19. So the question again is, are they admitted? If 4,000 people have been admitted with COVID-19, we would have seen it at primary healthcare level. There's no ways that it can slip up and not being seen by us. So that's incidental. And the figures that you need to look at is in ICU, people in ICU who's ventilated, and are they ventilated? And because of, again, the complications of COVID or primary admitted, like with Delta. With Delta, you admit them because they've got Delta. You didn't admit them because of some other reason, and we didn't even admit routine cases. Now, there's still no moratorium on any routine cases being admitted in the hospital, or any child with a diarrhea or whatever. There's no blockage of that system. So everyone, it is as usual. Everything carries on as usual, except if you are positive, that is then being reported as positive, but it's skew our data. And we've got a problem with that, because we need to know, like in Delta, how many people are really there because of the virus itself and its complications, not because you went in, you had a heart attack, you lie in ICU because of your heart attack, but also COVID detected. That doesn't help us. I hope this answers the question.
Thank you. Thank you.
Yeah, Dr. Angelica, I have another question from you guys. So I think this question came up last week also. When somebody is detected, like we see that there's a surge in the cases, but they're mild. They're milder than the Delta, and it's not a major problem, and even the hospitals are fine. So when there is a case which has been reported or detected by a agency, what is the first step you guys do? Like, is that somebody you just come and quarantine them in the hospital, or you let them how do you start the treatments?
Okay, Dr. Hussein can also come in here, but let me give you an example. You come in today, I test you, you are positive. I go through you will, I will advise you that you have to isolate. If the cases are so mild that we really only on very low dose cortisone, we have seen if you give it cortisone very, very early, and that is in contrast with what the scientist says, very low dosage with something like ibuprofen and Panado, that works the best for the myalgia and the headache. We then advise the patient, please, this is the following symptoms that you need to look out for. If not better, you come back, because in Delta, we did see them back in the follow-up because of the severity of the disease, and you never know when the patient would crash on you. But in this case, they don't come back because they're feeling fine after about 4 or 5 days, the adults. So you send them home, the rest must isolate, must quarantine at home. And then we will report it. You have to report it. It's compulsory to the NICD. And that's it. We don't, I've seen 4 patients back, but that was more for them to confirm that they are okay, and I'm fine with that. The rest, that's it. And they don't skip us and go to hospital because that's the mildness of the disease. I hope this answers the question. But Dr. Akhtar, you can come in as well.
Yes, I agree with you, Chair. The problem with those who have got very, very mild, especially I'm talking, I have met many healthcare workers, they just self-isolate. They're just self-isolating. They feel flu-like symptom 4 or 5 days, but there is a policy that they must stay 10 days. And none of them of healthcare, those workers went to the hospital. So there is a confusion that they don't get lost of taste, smell, and therefore they're feeling fine. So they do stay isolated not to infect other colleagues or friends at least 10 days. It's not like what we have gone through with the Delta and other cases.
What's the maximum fever you have seen in this particular variant?
Some of them don't even have fever. They just have a body pain.
Thank you. Atkar is correct. Only the children. I have seen one with a fever of 40 degrees. That was 1 out of 90 patients.
Wow.
I'm now nearly 90. I'm on
Yes.
85, I think. No fever, no oxygen. The majority, slight tachycardia, very, very slight. But that's not even a problem. So it's not the same than Delta. I'd rather take Omicron than Delta anytime.
Dr. Angelique, this is Alvin speaking. So, how many children among your patients out of the 100 are suffering from COVID-19, and they did have fever or not, and the cause of the disease in the children will be more severe than the Delta or the other variants before, or the same, not so serious? Thank you.
Thank you so much. One child with a temperature of 40. The rest, I've seen about 20 children. Anything, and my youngest was 4 months old, and on children that up till the age of 12, about 20. I don't have my stats here with me, but mild, none admitted, none. Those children, that is the beauty. The adults will take about 5 days. The children, 72 hours, 3 days later, that child is running around playing, and the difficulty is to get them at home, and they can't understand why they can't go and visit their friends. It is very interesting to see this, very.
Anyone has any other questions from South Africa? Otherwise, we'll move forward.
Yeah, Sharab, like our province, KwaZulu-Natal, there's no death since last 2 weeks, 0 death. But in Gauteng, they had 11,000 day before yesterday, they had 7 deaths. Same thing with the Cape Town, 3,100, but only 3 deaths. Those are the complicated cases. So some provinces, we don't even see any death at the moment. And hospitals, most of the hospital ICU and ventilators are empty.
Yeah, please go on.
Yeah, thank you.
Good. Yeah.
Can I ask?
Yes, Dr. Alvin.
In South Africa, has Omicron taken over as the dominant strain in the infected patients? Because it seems that there are more than 10,000 patients a day, but then the number of Omicron cases were less than a small fraction of it. Is it because it's not detected, or because of the laboratory facilities, or it is the overall scene is that the Omicron had not yet taken over Delta as the dominant strain there in South Africa?
If I can answer that question, Omicron currently is the dominant strain. And how do we know? You look at the clinical picture, it's the same clinical picture over and over and over again. So that's why we need to understand what is happening at hospital level, because there it's a bit different. We need to know whether hospitalization is Omicron versus Delta. My gut feeling is it's Delta and not Omicron. Majority, let me rather put it that, majority is Delta and not Omicron, because we would have seen it at primary healthcare. If it's severe, we have seen the Delta cases in primary healthcare. We saw at the 3rd week of when after Delta started, the Delta wave started, the 3rd week, we were already asking government to please have closed the schools, please put restrictions in. We asked because we saw what was happening. And that was the 3rd week of Delta. Now we're going into our 4th week. We're not even saying anything. We're only saying, if you want to bring in stricter restrictions, just look at the curfew, just make it 1 hour earlier and 1 hour later, and put a restriction on a lot of, on huge numbers at social gatherings. That's it. We don't see the same intensity. That's why we know it's Omicron, but clinically it's Omicron. So the question is, who's lying in the hospital? That's the question.
The other thing, testing, laboratory testing for recently, his numbers are gone very high, not like before, and it's on the public and private sector. I have seen data, private sector testing more than the public sector. It's almost above 75, 80,000 a day testing done.
Dr. Akhtar, can you just tell us the picture in other Southern African countries?
Other like Botswana, Namibia, Zambia, they also have a very mild same pattern, but I don't have their statistic, but their numbers are also low. And hospital admissions are very, very low. We haven't heard many patients who've gone to a ventilator from with the COVID-19 in other neighboring country. Like we have discussed previous last meeting, that it was too early to start banning those 6 African countries without having proper statistics and proper mechanism, without any discussion with the country-wise. It just happened all of a sudden and closed the border.
Angelique or Hussein, can you share, please, what is the positivity rate? Hence, you are going on a very big number, and I feel that is a reasonable for the testing. Can you share what is the positivity rate for the COVID, please?
24% positivity rate at the moment.
24%.
Last 24 hours.
Thank you. Thank you.
I just want to add here, remember, we are driving a campaign out there to tell the people, if you feel, and we give them the 3 symptoms, the myalgia, the headache, and the tiredness. If you have that, please go and get tested. So for South Africa, as Dr. Hussein said, our people go and test is 80,000, between 70 and 80,000 a day. Now, for South Africans to go and test, that's a huge thing. They're too lazy normally. So for us, we are extremely glad. So it means we can detect earlier, the virus and try to isolate and quarantine them. So so you need to look at as well at how many people are really testing, which is a first for South Africa. That was not the same with Delta.
Anjali, can I ask a question? Dr. Sajjad here.
Yes.
Anjali.
Yes.
Okay. I would just like to ask, you said that in Omicron, you have been receiving a single symptom of the patient, which is tiredness. And you said on examination, the pulse rate was high. So what you prescribe on that patient, which those who having only the raised pulse rate, what medicine you have given them?
On that first patient, I still prescribed for the fast pulse rate, because remember, Delta was in our heads and we know what is Delta. So we for colchicine 0.5 milligrams, we have seen if you prescribe that early in the disease, it sort of prevents severe myocarditis going forward, or the complications of that is less. So that was, I think I've prescribed that same type of thing for the first maybe 10 patients until I realized it's not necessary. So with the first patients, we followed what we would have prescribed for Delta. So the question now is, what do we prescribe now today for them? Only ibuprofen and Panado. That's a mypate forte combination in our country. And very low doses of methaquartin and that's what we have seen work like a bomb, and not waiting 5 days. You just started very low, only for 20 milligrams for 5 days, and that's it. That with mypate forte, that is the total treatment at this stage, and we don't need blood thinners. We don't need anything else, because these patients actually, whether you're vaccinated or not, are actually doing quite well, especially the elderly with a lot of comorbidities who have been vaccinated. I'm very pleased to say that they're doing extremely well, even though they might get a breakthrough infection. And that for me is a plus. And therefore the ICU is now our question, and we can't get that answers.
What about the beta blocker? Have you tried on these patients beta blocker? Is it helping? Not necessary.
No, it's not necessary. So even the ones that we now see with, so remember the fast pulse rate, the tachycardia that we see here is 103 or 105. With Delta, it goes up to 120, 130 nearly if they walk a few steps. And so this is, no, not at all. So we do, however, caution the patient, if they get tired, they need to watch their pulse rate and go and rest so that they don't push themselves. But at this stage, we don't even prescribe anything for the pulse rate, because it recovers so quickly that there's no need for anything. There's really no need.
Right. Okay, thank you very much, Anjali.
Okay, can I ask a question to Rob?
Yes, please.
Okay, this is Wasik Qazi from Pakistan. And thank you, Anjali and Akhtar, for a very detailed update of the situation in South Africa, because we were all looking towards South Africa since you initially reported in November, and it's almost mid-December. So my question to Anjali, do you think that Omicron has replaced Delta variant, since now it is the dominant variant found in South Africa? And are you doing genome sequencing for all those cases? in hospital? And secondly, can you make a comment that Omicron will definitely replace Delta variant in the coming weeks? Thank you, Angelique.
Thank you so much for that question. For now, I'm quite sure Omicron replaced a Delta in the average population communities, what we are seeing. However, we do not know the severity at hospital level because we don't have that. And do we do sequencing? No, it is easy. So there's two things. You go on the clinical picture. So I think if you have seen enough of them, it's like the Delta. If you have seen enough, you know this is Delta patient sitting in front of you. You just need the test to confirm that this is indeed COVID. So here the same. So, but the PCR testing at the lab, it can distinguish between Omicron and any of the other variants, or whether it's Omicron versus the other variants. Because remember, the Omicron has got a drop the S gene, so that is on the PCR test. If they can determine there, so they don't have to do sequencing. So if it's positive, if there's no gene, then they know it's the Omicron, that's on PCR. And if there is, then it can be any of the other variants, and you have to do genome testing there. But we all also know that the only other variant currently in South Africa is Delta. So, and that brings us back to the same question, who are admitted in ICU? Is it Delta or Omicron? Because we don't see Omicron severity at primary healthcare. None of our colleagues, I have consulted widely with the general family practitioners, and you know, every second day as well, I keep on asking, anything changed? And everyone after 4 weeks is the same picture. So it's definitely Omicron. So Omicron at this stage, in terms of transmissibility, replaced Delta. Not sure what happens at ICU level.
Thank you so much.
Sharab, can I ask, just wanted information.
Yes.
You know, we had some patient, first wave infected, second wave also is got infected, third wave, now we are having fourth wave Omicron, and the same patient is infected fourth time. I don't know, someone can put highlight on that, some input.
Dr. Akhtar, is he following the protocol? The patient that he was wearing mask and keeping distance, others. Did you ask him?
You see, once you get better, after a while, they just forget about SOP. So could be that another problem. But to get fourth time in a four wave, is there anything?
Akhtar, can I ask you whether that patient who had all the four strains, all the four waves, he got infected? Did he get the vaccination? Or
yes, he has been vaccinated. Yes, yes.
Oh,
so that patient must have been, a COVID lover.
you know,
Affinity to.
In Israel,
really strange because when we talk of getting infected and then getting vaccinated, we call it a hybrid immunization, hybrid immunity. And I don't know how come that patient got all the four waves. He was infected by in those waves. Very strange. I have no idea.
From Israel, actually, you came to know just recently that in 1,000 patients, they have seen more than 50% are breakthrough infections. More than 50%. in Israel,
Yeah.
and they had two booster doses, two doses they've been given. So they are suggesting for booster that way.
And the patient is living healthy and happily now. I mean,
Yeah, no,
no
patient is
severity.
fine.
So
Clinically, he's well.
luckily now he has Omicron, and Omicron will definitely give him the immunity that will, last and will not have any severe symptoms. Let's hope for the best.
Thank you. Thank you.
He's not definitely immunocompromised or something like that. He's a normal person, huh? Is it?
No, not immunocompromised.
So can I invite Russell for the update from Australia?
Well, sorry, one sec.
Okay, meanwhile, I can invite Dr. Pillay for an update, and Russell can come after that.
Thank you, Saurabh.
Thank you.
The briefing from South Africa by Dr. Angelique was very useful and informative. We learned a lot from what she has said, and that helps us to take precautions in our country as far as Omicron is concerned. In India, of course, Omicron, so far, 32 cases have been identified. Almost 30 have been in people who have come from high-risk countries. Now almost 57 countries are considered as high risk. And those who have come from high risk, only we have detected Omicron. And one or two has been local transmission from the person who has got it. So far things are more or less under control. And our daily number of cases definitely is coming down. Now it is almost 7,200 or so. Definite climb down is there. Mortality is less. Hospitalization is much less. And recovery rate has been about 98.36 in our country right from the beginning, if you take. And that definitely is good enough. Mortality, of course, is about 42 million. And so things are more or less under control. As for vaccination, 123 crores of people have been vaccinated. 85% had a single dose and 50% had double dose. Plus, of course, those who have got infected and all, totally the antibody titer in our population should be fair enough to give us sort of a community immunity. So that is where we stand. And regarding the booster dose, the opinion is divided even among the experts. Some of them say that there is no definite evidence that booster will help because wherever it has been given, no study has been done regarding what happens after booster dose, except in Israel, where the study has shown that myocarditis incidence is definitely less in those who had the booster dose, third dose. A final decision will be taken after the opinion of the Virology Institute, Indian Virology Institute gives the final opinion on that. But then the decision has been much more driven by the fact that more people remain to be vaccinated. And so that will be our first priority to see that everybody gets the second dose, because if everyone is safe, then you are also safe. So that is the dictum that sort of guides our government in deciding on booster dose. But then unofficially, some of the healthcare workers have taken booster doses, but the number definitely is not available. And after the schools have opened, all the teachers are asked to take vaccination, both the doses, and few are remaining to have it, and that also will be definitely implemented. And India has also, ICMR has also, Indian Council for Medical Research has developed a rapid test RT lamp where you can get the result within 30 to 40 minutes, and the sensitivity also is very high as far as this is concerned. Travel restrictions are not there, but of course, you should have the certificate that you have taken both doses of vaccine. So even in hotel stays or in theater and all, the vaccine certificate has been made mandatory. Then there is no compulsion on the people to take vaccination. Persuasion and reach out definitely is happening. At least in a few European countries, it is against the fundamental right to compel anybody to take the vaccine. And so that sort of an attitude is not there in India now. We are persuading people to take it. And the test positivity rate is about 5.2. And the Omicron cases, none of them have required hospitalization. As has been said by Dr. Angelique, it's very mild. And but then we are sort of asking them to be in isolation. And those who are coming from high-risk countries definitely have to be in the government-sponsored isolation places. And so far, I can say that things are under control. The whole COVID infection is almost getting controlled. Thank you.
Thank you, Dr. Pillai. And can you talk about, are you aware of the news where a 3-year-old kid was being diagnosed and as one of the 7 cases which was discovered in Maharashtra? And the case is pretty mild and there is no concern even though, but yeah, one of the person who was being detected was a 3-year-old kid.
Yeah, that's right. From whatever information that is available, all are very mild. The malaise, severe body ache and lassitude continues to be the main symptom, and the pulse rate is high. Other than that, respiratory involvement has not been in any of the patients, and none of them have really required admission. Other than the isolation, no admission has been required in Omicron cases.
And also, I think the government of India is working on the booster shot, but I think the primary focus is to get everyone vaccinated first, as a first and the second vaccine. Okay, so Dr. Russell, are you ready?
Yeah, sorry, I got cut off.
Yeah.
Okay, in Australia, we're having, as you know, the Omicron has come here, and we have, I think, there's a bit of about 45 cases in Sydney, other than that, none of them have been hospitalized, but of course they're all concerned for the numbers that may come. But they've done some early studies. I was just looking at the Kirby Institute and so forth, and they've with looking at antibodies, and it appears that the third, now we've got this third dose, but it appears that from their studies that the vaccine now are holding up, and the third dose, there's a rapid for the Pfizer vaccine, which in Australia we only used AstraZeneca and Pfizer. So there is a drop in the neutralizing antibodies, I think, for the Pfizer one. So of course the Delta, what do you call it? Giving the booster is likely to be helpful and useful, as Pfizer has also noted. The other areas that the Australia, they've just approved the for the 5 to 11-year-old, they've authorized the Pfizer vaccine. So the 10th of January, it starts to roll out for all the 5-year-old to 11. And they've also authorized the Moderna now for booster. So we'll have Pfizer and Moderna for the booster. People have started taking the boosters, and that's as far as it's happening in Australia. Yeah, the vaccine, it's rolled out. I think it's well over 95% in Victoria and New South Wales. I think overall it's reached around 80%. So the vaccine is going all right, and now the boosters started, and now finally the 5 to 11. So that's what's happening in Australia. Thank you.
Thank you. Can we have an update from Pakistan, Dr. Salma, Dr. Qazi, Dr. Sajjad, Dr. Ashraf?
May I take you from here?
Sure.
Thank you.
Yeah, sure. Good.
Okay, in Pakistan, Alhamdulillah, the situation is good. I've heard of 2 cases in Karachi. Dr. Kathir is from Karachi, so he'll brief us on that, but otherwise the situation is good. Where in the 4th wave, we even had 5,000 new cases every day once. Nowadays, we have between 200 and 400. Yesterday, it was 395. And the total deaths so far in Pakistan since the corona started is 28,800, which, thanks God, is very good compared to other countries. And about 30% of our population has been vaccinated, which is another good news. And the government is encouraging the booster dose for elderly and for healthcare workers. The Omicron cases, the 2 that have been reported in Karachi were Dr. Kathir or Dr. Qazi Wasik, since they both belong to Karachi. They'd have more info on that. I would request them to tell us more about it. Thank you.
Okay, thank you very much, Madam Dr. Salma Kundi, President PMA. Actually, I'm thankful to God that we have a very little number of cases, positive cases, near about 0.76 from the last 1 month, I can say. And the 2 cases being detected day before yesterday in Karachi, which is still in process to confirm about 2 cases, but the sign and symptom is related to Omicron. But the authority is still not accepting these 2 cases as a Omicron, but they are still confirming, and they, according to them, they will confirm after a week. So this is the situation, and regarding the vaccine, the people of at least in Pakistan, 45 to 50% people have been vaccinated with the first dose. The problem is the second dose. Most of the people are, after having the first dose, they are not going for the second dose, which is very problematic. I would like to know also, anybody can answer after first dose, after how many days you can have the second dose, and after that the second dose is not effective. They have to have the first dose again, or and then second dose. Anybody can answer. Thank you.
Thank you. Dr. Qazi, you want to add something?
Oh, yes. Thank you. Thank you, Madam Salma, and thank you, Sajjad. As he pointed out, our positivity rate is 0.7%, and in the last 24 hours, we only had 11 deaths. We are talking of a population of 220 million people. And things have opened up. People are, living with the normal life, and schools, markets, and everything is open. What the government health authorities are, educating is that one should have booster doses now, because we had these Chinese vaccines, first dose, then after 3 weeks, we had the second dose. And as they say, that if you had the 2 doses in the last 6 months, since the immunity wanes down after 3 to 6 months. So they're saying that we should have a booster dose, and that is the Pfizer vaccine. It's freely available and it's being provided without any charges. And for all the health workers, 50 plus people, and even the younger people have been asked to get the booster doses since we all had our second doses 6 months back. So me and all the people with me sitting here had the booster dose, and luckily Pakistan Medical Association also started at his, at the
Head
PMA,
office.
head office. The booster dose is available for the healthcare workers. So situation is well under control. Life is back to normal. And as the South African update gives us the information that Omicron is replacing Delta, and I think that would be the savior, because Omicron till to date is very mild, no hospitalization, and let's hope so that we got away with the Delta variant and have Omicron, and let's have this the savior of the world. Thank you.
Okay, Saurabh, I just want to add on Dr. Qazi, what Dr. Qazi said. It's absolutely true. In Pakistan, we have absolutely a normal life. Everything is open. The markets, the restaurants, the marriage hall, everything is in normal. But the situation is, even the Pakistan Medical Association, they are very vocal for the SOPs, to follow the SOPs, but the people are not following the SOPs. We are worried about the Omicron as well as the 5th waves in Pakistan. So I don't know, the same behavior is going on in other part of the country. The other people of the participant can say what we have to do. PMA is always on through the media is requesting the people, please follow the SOPs, please get vaccinated. But people are very much reluctant to get the vaccination and not following the SOPs. Anything anybody can guide us what to do to convince the people, or you are facing the same situation in your country? Thank you.
Sharab, can I have some more information about Omicron diagnosed in Karachi, 2 cases? Is there any travel history, contact history, or is there any tracing of those contacts?
Yes.
Or
yes.
How does it came? That's my first. I need some clarity on that. Second thing is, 30% of the population got the vaccine. So 70% still need to be covered, or at least 80% need to be vaccinated. So the booster dose, will it work if 70 to 80% population didn't get the first single dose? That's my concern.
Yes, you are absolutely right, Akhtar Hussain. The 30% population have been vaccinated completely, and near about 50% are partially. And these 2 people are having positive Omicron cases. They are coming from abroad, and they have detected in the airport, and the contact tracing have been done, and the 11 people are in observation. They are 2 or 4 people are being diagnosed as a Omicron according to the symptoms and their PCR test. But still, the government is not accepting these these cases as a Omicron case. They are still working on that. In Islamabad, the higher authority and the lab, which is the National Institute of Health lab, which is the authority to confirm the case of Omicron. So we are waiting for that, and they have taken 1 week.
Okay, may I add something? Thank you, Akhtar. Your question is very pertinent. Actually, the adult population is about 50%. That has been majority part of it has been vaccinated. But still, since the situation is quite under control, we have a very good system of telehealth medicine. In fact, the initial waves, we had, complete monitoring through that system. And the EduCast is the one organization which was working with the government of Sindh. And then it was, endorsed supported by Stanford University and Dow University of Health Sciences. And PMA has also collaborated in extending the telehealth medicine services, wherein anybody who is being tested positive is being monitored at home, and they provide all the necessary medical advices, and they completely monitor the patients at home, and anybody requiring any hospital visits or further testing are being advised accordingly and supported by this telehealth system. So it has very effectively worked, and on lakhs of patients were monitored and thousands of patients were provided the services through the virtual doctors being present to provide any services there. And even for the Omicron, the PMA and this EduCast, along with Dow University of Health Sciences and Stanford University, are going to implement this telehealth program very effectively. And since the situation is well under control and people are, being very satisfied with the present situation. So the COVID situation in Pakistan seems to be in a much better position, and we can't say what will happen in the weeks to come, but still we are fully prepared to deal with the things. There's no hospital pressure or patients going Thank you.
Regarding the after questions about the booster dose, the government has announced only booster dose for those who have been completed their second dose, and only above 50 years of age people can have this booster dose only. But the government as well as the Pakistan Medical Association forcing the people to get vaccinated as early as possible. Thank you.
Dr. Saurabh,
Yes, Dr. Jamal, please. Your update, please.
You're from Bangladesh. Yes, thank you so much for me. Actually, in Bangladesh situation is good, we can say, actually, because we had actually per day near about 100, just above 100 cases. And this is very low, and we are testing near about 20,000 per day. But that is showing very less actually. The infection is near about 1%, and the death is very low. Just 1 or 2 cases, 3 cases like that. Some days we are having very nil also. So this is okay. About the vaccination, the target population we had decided at 80%, and taking into consideration those 80%, 62% are vaccinated first dose, and 30% given the second dose, already fully vaccinated, I can say. And regarding the SOPs, it's all the same. People are not following that. Very less. You can say 70%, 75% not following like that. So even then it's good. The situation is controlled. And we have actually 2 cases from Zimbabwe. Our 2 cricket players, female cricket players, they came from the competition and they got tested positive. Still, we are not sure whether it is by Omicron or not. It's going on. The tests are going on, sequencing are going on. Thank you so much about Bangladesh.
Thank you. So I think we've covered everyone. Dr. Ashraf, you want to speak anything? I think you've missed out on your side of it.
Thank you very much, Saurabh. I think Dr. Kaisar, Salma Kundi, and Dr. Qazi have talked about Pakistan. The reluctance about the vaccination, it is a very big issue in Pakistan. And I believe all the countries neighboring like India, Bangladesh, and having the same sort of culture, we have a problem for vaccination about here. Although as the organization, Pakistan Medical Association, we support the government to enforce the vaccination program and do it in all the best way. Although we are very low number whatsoever, because the vaccination at the Israel people, they have done the 5 years and uphold for the older ages. And in Pakistan, unfortunately, we are about 25, 26% who have been vaccinated. I would like to share about the new concepts of the vaccination to be called as the completely vaccinated, that is with the booster dose 2. Here in Pakistan, we are still far away, I believe. And luckily, thank God that we are safe still. As far as the Omicron is concerned, still it is in the, as Dr. Kaisar has talked with you and informed, that the cases are for the verifications in the National Institute of Health, Islamabad. We do not have in Pakistan that much capacity to get tested. I hope if Omicron is there, so genotype and so on, that process will be done soon here. So luckily, we are very much blessed that Pakistan is still safe. Thank you very much, Saurabh.
Thank you so much. And with this update, we would like to close the session. If anybody has a final comments, please do come up and speak. Otherwise,
just one comment actually, that I raised that point actually, which Dr. Alvin actually posted. I told you this is very important because actually this is that was a public hearing going on in the USA regarding the vaccination, booster vaccination. Very important. I have gone through the discussions, and I think if you go through, you will also find it very interesting, because the cases are coming up like this, the death cases and more death cases are there because of heart problem after vaccination during this period. So these questions are coming up like this. And even in Israel, actually, regarding the booster dose, when we literally fully vaccinated, when you term it, because in USA there is a lot of controversies going on whether the 3rd dose is needed for this, and they're asking Pfizer why you have not told before, why you have not conducted these trials before. All these things are going on. Lot of questions are going on there. So thank you so much. Good.
so thank you everyone for joining in. With this note, we would like to end this session. This was 88th session. We would be coming back again next week and with a new topic and a country update from CMAAO. Thank you everyone for joining in.
Thank you so much. Thank you. Saurabh, please, can you contact these